Loneliness has become a problem for so many people, and experts are saying that it doesn't have to be that way. Joining me to discuss this is Dr. Marilyn Fraser, who is the Chief Executive Officer of the Arthur Ashe Institute for Urban Health. Dr. Fraser, welcome to Brooklyn 45.
Thank you so much. It's great to be here.
Well, let's talk about loneliness, which has become a problem for so many people, not just adults, but younger people as well. Why is this so?
I think a lot of things, when we think back about COVID more recently, a lot of people have become more lonely and have become isolated as a result of COVID. And it's something that has had so many repercussions on the older folks, but also the younger generation. When we think of them being out of school for such a long time and not being able to interact with their peers, that in itself has caused some of the social isolation or being away from others. And so young people as well as older folks have been affected by it. And we know that there, because of social isolation, there's so many other things that can happen as well.
Why are experts, and you are an expert as well, but why are so many experts calling loneliness social isolation?
Well, they're kind of two different in a sense. With social isolation, it's more something that people do not have contact with other individuals. They may not have the social networks that they need, and they may be away from other people. Loneliness is when people feel alone, because people could actually have people around them and still feel alone. So the loneliness is more feeling that you're by yourself. And that there isn't that support, and so you feel alone, and that's where the loneliness comes in. When we talk about social isolation, it's just not being in community with other people.
There are some stats that I find very interesting. I'm pretty sure that you are aware of some of these stats as well. That says that 61% of 18 to 25-year-old people suffer from loneliness, and 50% of people between 50 years old and 60 years old suffer from loneliness. Why?
Oh my goodness, it's been something that I think as time has gone on, our networks are different, right? We have become a community that we are paying more attention to probably social media and media venues and avenues, as opposed to interacting with others. We are not in the community that we had before, where you go visit other people. Now we don't even pick up the phone to speak to people. We may text and be distant. And even some of those interactions that we have become used to might be contributing to that loneliness. It might be contributing to that distance that we may feel. Families don't get together around the table anymore for dinner. People may just be on the go. Kids could be together. I've seen young people sitting together, and then they're on their phones and they text messages to each other, so they don't communicate. So we do not have the communication that we once had. And then we had a pandemic that kind of like put us in a tailspin that removed some of those interactions that naturally happen. Places that were considered to be key places in the community, such a lot of the work that we do in beauty salons and barbershops, people would just go there and sit down and talk to each other, but then they were deemed non-essential, so people weren't going there, and those places were closed down. Churches and faith-based institutions were closed during COVID, and those interactions, and some people go to those places so that they could interact and they could feel a part of community. And when that's destroyed or that's dismantled, it becomes an issue, and it contributes to these feelings of loneliness. Also, it contributes to the social isolation that people may have as well.
Well, we are all hoping that we do not re-enter a COVID phase. But the Surgeon General's office, they have referred to loneliness as an epidemic.
Yeah, yes, because more people are feeling that way. More people are feeling alone. We came out of the pandemic with a lot of people having mental health issues because of the loneliness, because of the social isolation, and those things contribute to your health, right? Your health and your well-being. So those things contribute to how you feel about yourself. It contributes to heart disease. It contributes to stress situations, and sometimes those situations in themselves, so it could be a vicious cycle, because some chronic diseases could make people feel alone, or could make people feel isolated, because they do not feel as though they are in the normal quote unquote sphere, or they are part of the community that they once were. So they may isolate themselves because people may not be able to relate to them in certain ways. So it's a vicious cycle. So it's important for us to talk about loneliness. It's important for us to talk about isolation that may happen. And as you mentioned, it's at both ends of the spectrum. So you're seeing younger people as well as you're seeing older folks that are going through those things.
I want to talk about the importance of building relationships. But before we do that, tell us a bit more about your organization.
Oh yeah, so the Arthur Ashe Institute was founded by Arthur Ashe just a few months, 2 months before he passed away, and it's focused on community engagement and health promotion. And we do that through beauty salons and barbershops, faith-based organizations, where we go out and train our barber stylists to talk to their customers and their clients about health. And also, another important aspect of the Institute was to increase people of color in the health professions. And we do that through our Health Science Academy, which is a pipeline program beginning in middle school and going through high school. And we hope that students would come back once they're finished being qualified as healthcare professionals, come back into the communities and serve. And we recognize that these are the things that we need to do to improve health and to address the inequities that occur in health, making sure that we are increasing and diversifying the workforce, but also ensuring that we are promoting health and linking people to the needed care that they have to have better health outcomes.
So let's talk about building relationships. We know that relationships are important. And if you are in relationship or in relationships, the likelihood of being lonely is diminished vastly. Talk about the importance of relationships and building relationships.
Yeah, relationships, that's important. When we talk about health, I usually refer to the World Health Organization definition, where it's not just a mere absence of disease, right? So your social, your spiritual well-being is also important. And the social, building those relationships, that's important. I think we were never meant to be alone. We are meant to be in relationship with others. And the relationships take on so many different aspects too, and different forms. Just having relationships where you can communicate with people, that you can share ideas. It helps our brain in terms of communication, and just being able to talk, argue, and those different things, and to think critically, because you're in relationship and you're talking to other people. Even from the time children are coming into the world and they start to play, and those things help them with their social skills, interacting with others. And likewise, but as people get older, you need those relationships, and it becomes harder, because as you age, sometimes for people, their friends pass away, or their friends may move to somewhere else, and those relationships are fractured, those relationships are broken. And they're important. Bonding is important. It's important for our mental well-being. It's important for our health. Folks that are in relationship live longer. In good relationships live longer. And you want to make sure that those things are fostered and those things are nurtured as we go along.
There are people who say that one should be deliberate in building relationships. How do you respond to that?
I think so. You know, my mom would say that you should not try to make a friend when you need one. You should be doing those things all the time, right? And you should be fostering relationships and talking to people, and so that in the times of struggles, times of challenges, you have people that you can talk to, and that you feel more connected with, that you're less isolated and you're less lonely. You have friends that you can share things with, friends that can give advice, and that you can give advice and build people up, and it helps in just fostering and being intentional to foster those relationships. I worry that oftentimes when we're in a society of just texting and social media, and where we could be in the same room with someone and not even interact with them, I worry that that will have different ramifications later on, and people will not know how to build relationships, or people will not know how to foster and sustain relationships, which are needed.
You mentioned social media. Talk a bit about the impact, that negative impact of social media.
Yeah, but social media could be very isolating, because sometimes you're just paying attention to what's seen on a screen, paying attention to whether you get a like, or how many likes you get, or whether people respond to the things that you post. You post so that people could view it. If you don't get a lot of views, you may feel less than. And then if you compare yourself to others that may be more popular by the number of people that may view or comment on something, we know that it's been negative in terms of people bullying, using social media to bully others, and children and young adults, and even I guess adults have been affected by that. So it's important that we find balance in the things that we're doing. And yes, you can go on social media, but when you're spending most of your time posting and looking to see whether people commented on your post, and whether it's a positive or negative comment, and you become glued to social media, so to speak, then it can negatively impact you, because the world is going on outside, and you're not paying attention or being actively a part of the world. You know, people don't go outside, people don't walk as they used to, children don't play as they used to anymore. They may play video games, or be bound to social media, and being sedentary, where that can impact, you know, your health as well, because you're not moving. And we talk about physical activity and being more active, and you can't do that if you're sitting at home just thumbing through your phone to see what's going on social media.
And more people are driving cars, and people are not really using the subways as often as they used to, and particularly not using buses the way they used to. And there have been opportunities, if you are traveling on public transportation, to maybe have a conversation with the person next to you who you didn't know.
That is so true.
So how do we regain that? I know people probably feel better if they, or feel safer if they're on a plane or on the train or on a bus, and they're minding their own business, because they don't know if the person next to them may say something or do something they don't want them to say. But there is value in traveling on public transportation.
Yes, they are fair sometimes in terms of traveling on public transportation, but as you said, just the interactions, even being outside of your car and walking and going to places, going to public spaces and sitting down, having dinner, those things, interacting with friends. I think that those things are really important. And as you said, you have to be intentional about it. So if I took a car every time or I drove every time, I'm not interacting with anyone. I'm just like, I just going where I need to go and then coming back. So it is important for us to be a little bit more intentional, even when we go in, for people that are people of faith, going into church as opposed to being on Zoom, right? And interacting with people, utilizing public transportation or even carpooling more so than doing things on your own. I think it's been something that we have kind of isolated ourselves, and it creates more isolation, creates more loneliness, that you become a kind of like just by yourself, that you become an island, and you do not want anybody else to come onto that island. So you need to form some bridges, so to speak.
You mentioned church. I was at a church a couple of Sundays ago, and one of the leaders suggested that people get up and say hello to someone close to them or someone from another aisle. And is this a way of removing this social isolation?
It's a start. It's a start that you can talk to other people. I think in churches, sometimes it's easier because you may feel more accustomed to the person across the aisle or accustomed to others. But again, in some churches, depending on the size, some churches are large, and you may just go into the church and you leave, and you may not interact. There may be churches that have different groups, and the small groups that you can participate in, but you may not do that because we have become more insular in one sense. And but it's a good way to start, to make sure that people are interacting and moving around and so on, even in classrooms, for students to get up and move around, even to have those. At one time, it will probably be icebreakers, but have those interactive games that people get to know each other and get to talk and have conversations that are not based on my texting you or a conversation that's on social media, a fight that happens on social media, for instance, but making sure that people get to talk to each other more.
Talk about the importance of volunteering, say at a library, where you do see other people and you can interact with such people, or volunteering in places where there are a number of people who congregate, and you can develop conversations with such people. Talk about the importance of volunteering.
I think volunteering is important. I think yes, it is an important thing in terms of your social and community service and interaction. But even with volunteering, you feel better after volunteering because you're doing something to help. Whether it's assisting some organizations so that things can run better, or assisting people in the community, those things help you, right? As you pour into people and as you give of yourself, those things help you to feel better. It helps to remove loneliness. It helps you to see the way that other people may live and understand other people. And it helps also to take the focus off of yourself at times and focus on to others, and focus on others. So that helps in so many different ways. It helps so in your socialization, but it also helps in terms of how you may feel about yourself, your self-worth, your value may come out with volunteering.
And you help others.
Yes, definitely helping others. It helps you to feel better.
At the beginning of the program, you mentioned Black women. And I did not quite get what you said about Black women, but is there an issue or a problem where Black women are more likely to become lonely or to become less socially active?
I think it depends, right? Because I think it depends where people are in terms of like professional lives and so forth. I think oftentimes people may be marginalized and be a part of a group that's marginalized and sometimes not seen. And I think oftentimes Black women, Black people in general, sometimes by others may not be seen. And they're there and they're worth being seen and so forth, but because of our society and when we think about race and racism and so forth, you may not be. And it lends itself in some professions that you may feel isolated more so than others. If Black women are in positions where they may be male dominated or white male dominated professions, they may not be seen and they may feel more isolated and feel more lonely because they do not have peers that they can talk, that they can interact with, and that may cause them to feel lonely or feel isolated and feel as though they're not heard. So it depends on the profession, it depends on, and some people may say it does not. It's just sometimes in our society that we may not be seen as much as others.
You're with the Arthur Ashe organization. Are there other organizations that you are aware of where people can go to help them get away from being lonely?
Oh yeah, so there are so many different places. So there are organizations that focus on mental health and mental well-being. There are organizations that may focus on doing things, right? So there are senior centers. Like some people may be like, oh, I don't want to go to a senior center, but there are senior centers out there that people can sit and socialize with others. There are youth camps that young people can go to. Their youth groups. Some churches may have youth group. Faith-based organizations may have youth groups. Some after-school programs may focus on youth. But there are different things that people can do to remove that social isolation or diminish it, so to speak. And that involves interacting with others and going to places that may have those groups that you can come together and have those sense of community.
Let's talk about the positive values of being involved in social media. We know there are lots of negatives. And
yes, definitely. Oh my goodness, there are so many. There are positives in social media. It's a place that we can reach masses, right? Instead of going door to door and giving out information, you can reach masses on social media in terms of giving a message that many people can have. And why not use it for that, right? Why not use social media to promote positive images, positive things, positive images of ourselves as a community, positive images of the people that we may serve. So there's that, the connectivity. And when we think about just social media, connecting to people that may be far away from us, there's a time that you needed to communicate via phone, you needed to buy phone cards, for those of us that may be of Caribbean descent, and even folks that may not be of Caribbean descent, but have people and friends and family that may be miles away, you're able to utilize that in a way of communicating and sharing. Families can keep together by having group chats and so forth. So there are positive things that could be wrought out of social media. It's not all bad. It's just making sure that we accentuate those positives and try our best not to be so much into social media that we become addicted to social media.
And that often is a problem with the younger people, although there are lots of people like you and lots of people like me. I was at this event a couple of days ago, and there were older people at that event, and all of them had one of these things. And
yes,
and they were using them. I suppose that is one way of getting away from loneliness, getting away from being socially isolated. But these are some of the important things that we can do. But let's talk a bit about the discouraging younger kids from using these devices? Because lots of them use these devices and they don't use them for schoolwork.
Yeah, so and also the blue light, the light and so forth, and being on those devices for a long time that may cause you not to have good sleep. And sleep is so important to our health. And it goes for the younger as well as the older. As you mentioned, people are utilizing the phones more, and it does create a little bit more social isolation because you're just plastered to the phone and not really interacting with others. And you don't get to sleep, and sleep is so important to our health. And if we keep watching TV late or being on our phones late, the light from there just keeps us up for a longer period of time. So I would really discourage as much as possible that we stay away from just being wedded to our phones, and that we find a balance, because the phones are important, but that you find balance.
Okay, so it's important to celebrate each other. It's important
Yes.
to, and if we are celebrating other people, then the fear of loneliness or episodes of loneliness are driven farther away from us. We have about half a minute left. So let me give you the final words, Doctor.
I think it's so important to talk about loneliness and social isolation, but there's so much that we can do and be intentional about doing it. And so I really applaud you for talking about this and bringing this subject to bear here to this evening. And so it's really important that we try our best to encourage others and to improve social isolation.
Dr. Marilyn Fraser, we thank you for being our guest here on Brooklyn 45.
Thank you so much.
And to you, our viewers, we thank you for watching this program. You can watch it again on our YouTube channel, youtube.com/Brooklyn45TV. We invite you to support us. We are a 501c3 not-for-profit organization, and when you support us with a gift, you benefit as well, and our viewers benefit. Please tell your family, your friends, and your work colleagues to watch Brooklyn 45 on cable television and on YouTube. On behalf of our team here at Brooklyn 45, I am Sam Taitt.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/Brooklyn45TV. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.